I wanted to see how things worked. And the only way to tell about people is be involved with their total care. So when I graduated from all of that and set out to get practice, one of the doctors from here locally recruited me from my internship at St. Elizabeth Hospital. And so I came to work here in Miamisburg with Dr. Regan, Edgar Regan. And so by doing that, I also was automatically had to go in and get trained for his same thing he was doing at the Mountain Lab too. I just added catering to the work that I did, because I was here several years before catering started up, working at St. Elizabeth Hospital and Miami Valley too. But we admitted our patients at that time. If we had surgery that was going to be done, we wouldn't do it necessarily. We would step in and be an assistant. And there was one aspect of it. We did do tonsillectomies as a family doctor. And we delivered our own babies. We didn't send them off to an OB/GYN. We did it ourselves. And that was one of the things that interested us from a standpoint of having work to do. When we came from Louisville, Kentucky, from the University of Louisville, when I came up here, one of the things that we noted was that they had a large OB practice at the hospital. Of course, being Catholic, they had a lot of deliveries, and that's where I delivered in just one quarter of time of the year. I delivered enough babies. I think I counted it was about 400. We enjoyed it, but sometimes it could make you feel like, why did I really do this? If we had a patient came in the office and he was feeling bad and we diagnosed pneumonia, if he was bad enough, we would be the admitting doctor, and then I might call a pulmonologist or an internal medicine doc to help with the management, because we had some unusual cases, and when I admitted patients and then called somebody in to see them, and one of them that I remember was a landmark thing, was a young lady that her family brought her up from Florida, and on the way up she got sick. Of course, this had been brewing for some time, and then she stopped on the way at one of the hospitals. They said, well, we're bound to go to someplace near Dayton, Ohio. And so they brought this girl in, and she was really very critically ill. She had tuberculosis of the spine, very uncommon disease. And so when I called Dr. Leary, who was the local internist around, I said that they identified mycobacterium on the stuff, because I did a spinal tap on her, and he said, I've been in this institution for 10 years, and he said, this is the first case of TB of the spine I've had. I said, well, I had mine all at once. I said, I get my experience right at once. I said, what do we do? He said, what you did. I said, oh, you mean starting off with a little equation of what to do for for spinal meningitis. So it was really interesting. Even up until the time I quit medicine, which was in '07, I found it very interesting. And there are a lot of things that you can look into and see. And with that you would have to have the help of the hospital to help you with with some of the things that we were doing. And when I wound up with the last part of my practice, it wasn't family practice, it was occupational medicine. One of the things that I liked was their I guess how I would put it, their care and their empathy that they have for their patients, and the total care. They didn't just suck you in, give you an IV, and such, and then a few days go home. There would be a more involved portion of this. And also part of it, which appealed to me, was they would participate with the patients in some religious aspects of it. And I thought that was really interesting, because I think through the years that I practiced, I had a few cases I worried about, and I think that you can sometimes relate too much if you aren't watching what you're doing, but you need to give a sense of caring for your patients. And I had a case not too long ago with a young man who was a chiropractor. Said, my mother's is having a birthday, and she's wanted to know if you would come by and see her at Milano's Pizza. Says, we're having a party for her. And she said, I want you, would you come and see us and participate with our celebration? I had delivered her twins, and he was one of the twins that recruited me, and I felt sort of honored by doing that, knowing that somebody would take the time to remember that. She said, of course, she said, I didn't have any trouble remembering it. Delivering 2 babies in one sitting, she said, is enough. Early on, I was involved with part of the opening up of Kettering, and it was slow to begin with, because that was sort of strange to have a hospital with many beds and not full. But that later on developed pretty good without any problems. But the administration, I was in part of the committee work where we were trying to get the doctors to come to Kettering, and we had a group of several doctors. And I wasn't in the initial group, but one of my good friends who was a surgeon invited me to start coming to the meetings if I could. And as a result, we learned to help out our ways with the medical staff. And as time went on, the medical staff development it just sort of seemed to develop as a very commendable thing, and really friendly staff. And all the medical family practice docs, of course, have their side of it. They divided them up into family practice or primary care, OB, GYN, internal medicine, all the various divisions and surgery. And I think what helped me was the fact that I had practice with taking care of the total care of patients, because when we put patients in the hospital, we wanted them to have care as the best that they could get. And we felt that the development of good care with Kettering Hospital was really important. The medical staff development took a little static for a while about minor things, but nothing really that was earth-shaking. one of the things that they had, and you may have touched on it here with the other doctors, but when it first opened, they were all shocked to find they couldn't get their meat in their diet, and all the diets were meatless, and that was part of the Kettering doctrine, and that they do that. So they solved that, though. Finally, I think they sent the meals over to the golf club. Not as long as they didn't have to prepare them here, but that changed as years went by. They convinced me, saying they needed my expert help, so to speak. I said, "Why don't you run for chief of staff?" and I did. But I also eventually liked what was going on. I wanted to see how things worked, so I even was appointed to the board for a term. And that was interesting to see what all the things that it takes to run a big organization such as Kettering. But I can say this about Kettering Hospital, and I know you know it's not solicited, but I enjoyed being at Kettering Hospital and seeing all of the intricacies of medical care and what it takes to keep people going. It's interesting going back to my early training and when I was in school and high school and college. The things of what makes people work, probably the thing that makes people work the most is their feelings. And like I said earlier too, people having empathy with their patient and their care. And that's probably one of the biggest aspects that you have in the care of medicine, and also all of the intricacies of things that you have to do. Look at the fuss that's going on about medical care now. I'm sure if you watch TV at all this past 2 or 3 months, it's really been a whopper. Well, getting people to cooperate is the biggest thing. And having a strong medical staff was probably the main thing that we would have to develop and keep ourselves well advised about all of the things that are going on with medicine from the standpoint of this kind of care and that kind of care. And the Seventh-day Adventist program was just one of those things that really was interesting to begin with. But throughout all of it, it came out at the very end out here. It was with being an excellent hospital, and look what some of the things they did with the cardiology and various other aspects of it that the hospital satisfied a lot of people, and then being a part of that, from my standpoint, was to making sure that the medical staff was, I guess you'd say, well versed in all of the things that they should be doing. I had a patient of mine who was rather outspoken. He said, when are they going to get some good food in this damn place? And I said, it's not the food that's going to make you well, it's what your doctor does. And George was his name. He was a patient of mine, and he had a chronic problem with his colostomy that he had, and he was in the hospital occasionally. He'd come in. He would fuss about things. I said, well, what you need to do is make out a statement, and we'll submit it to the medical staff committee and see what we can do about it. He says, I don't need to do that, he said. He says, give me one of them to talk to. So as a result of it, I arranged for one of the administrators at the time, and I said, would you go up and talk to this patient of mine? I said, he said, why did I do that? I said, well, why don't you just allay his fears about what's going on with him? He's afraid they're going to jerk his religion out from under him. And I said, we can let him talk to him. And he agreed to it. So the administrator from the hospital, the one that they chose, was one of the better voiced doctors. He really did a good job and sold me. So when my patient came out and talked about it, I said, how did it go? He says, well, you know, he says, I think those seventh dayers have got to something really good about it. He says, I'm thinking about looking into it myself. My personality is such that I would go around and talk to some of the people, especially after I got into the medical staff office. But I would come up I would come to the hospital every day, and then still go to my practice in the latter part of the day. But I would come in the early morning and go by the various nursing units and ask them if they had any problems or whatnot, what was going on. And it was interesting to see what they wanted, and most of them, I would say, it was. You asked me how did I feel? It was interesting to see how people grew into this program that Kettering had, and as a way of doing your living. You got to realize that you may have a profound or not so profound effect on people as you go through life. And I was watching that at the time I was making these rounds, and I used to ask them, the nursing staff, and the rest of the staff too, but the nurses and various administrators, they would go and talk to the patients or advise them on things that they can do in a whole vast array of things you can do to help people with planning for the future with their illness. But I felt like it was a real good opportunity to see about how the inner portion of people work and how they interact. But most of it comes back to the standpoint of, do they really show us some way of caring? And it doesn't have to be church related, but that doesn't hurt. No, I think I liked the fact that I could take care of somebody, and the last visit that they would need to visit with me was their closeout, their disease or staff, or their various illnesses were well. Success in treating the human beings was very important. But one of the doctors that I scrubbed with him on cases of surgery we have. If we had a patient with had a hernia in operation, we would be the first assistant to the surgeon. Or if we had somebody had a lung tumor they had to have taken out, we would go there with the doctor of pulmonary medicine and assist in his case so far. And as a result of that, one of the doctors that I really got I had a lot of respect for. Most important was Dr. Schuster and his group, and their care that they gave. That he came in one day at the doctor's lounge, and he said, "How are you doing?" I said, "I'm doing fine." I said, I sent somebody up to see you recently." He said, "Yeah, I know." He says, "But I want to let you know something." He said, I said, "What?" He says, "I think you have good taste." I said, "Why is that?" He said, "Because," he opened his coat and he pulled out his tie. He says, "Because we're both wearing the same tie." and he was a good person to see and talk to every day. He was sort of a morning jolt to get up to the doctor's lounge and have some coffee, which they didn't have to start with. And that was one of the things that they had to talk that one in. I think somebody said from the administration said, "I think that staff's going to resign if you don't get some coffee." Dr. Schuster really made a big impression to me, and I think that it was important in the development of the hospital and its various programs. Well, I think technology is going to have to help us a bit to start with, and I see that it looks like it's advancing that way. The hand of technology is going more and more, doing more things with various technological components. But I think the medical staff that we have here has enough people that they should be able to look at this program and develop it, and bringing it into the institution so that you can go see and look for different things to do in your medical staff, and be open to new methods and new things. We averaged in family practice with our practice something like 300 to 400 babies a year were delivered, but my practice alone, which included some previous stuff done at St. Elizabeth Hospital and also at Louisville General Hospital, it was something like 13,000.
That's a lot of babies.
It was a lot of babies. Well, I delivered at St. Elizabeth. My rotation of labor and delivery was I think I had a 2-month rotation, which I would sleep and rest 24 hours, 24 hours. And then counting up all the ones I had then at St. Elizabeth, I delivered an awful lot of babies. But then in my family practice, we were really busy because we had a lot of people that wanted somebody to deliver the baby. And I didn't deliver them at home, not intentionally, but I did wind up with a couple of ladies that they asked for somebody to come by the house. They said, "Something's wrong with the wife, she's bleeding." And I got there, and this elderly lady met me and said, "Come on in, she's here on the bed." So I said, "I got a few things ready." I said, "What have you got?" She says, "Well," she says, "it looks like she's about to deliver." And I said, I checked her and I said, "Yeah, she is." And she said, I said, "Who are you? You're the family or what?" She says, "No, I'm the Avon lady. I found her on the floor, moaning in pain." And we had the baby right there. The obstetrics part of it was really interesting and funny. In medicine, some people accuse me of being too funny, or trying to be, but I enjoyed it, and I think you could make a humor out of almost any aspect of medicine that you can do. Not really many challenges because the hospital was fairly well accepted that it was good to have an auxiliary hospital in that area, and I'd say the overall support that came to us from funding this was probably more about getting the doctors to come to the southern parts of Montgomery County and getting the various doctors. Now there we did have a little bit of problem getting some doctors to come and see people on consultation, and my talk was to just talk with them like we've been talking today. We have a need for people to come and see our patients, and at that time I was second in line from being the medical director for Sycamore after I had already done some of my stuff with Kettering as its chief of staff. Being two chiefs of staff is not anything that's a lot of fun, because you have to make more out of it. We heard from various people, and they were amazed that we had as much, I say, friendly atmosphere. It wasn't big, and as a result, there were a lot of people working there. A lot of people working there that were also patients of mine too. So I had to be careful and not show any preference to anybody. But it was interesting finding the interaction with that group of people. They were a friendly group, and they were anxious to see the people get well. They were interested in them, plus the fact that many of them knew each other, or they were the neighbor down the street or whatever. Well, I've always felt that if you keep an honest face and do your job well, humor will find you somewhere, and it'll help you with the management of your cases and yourself. Humor doesn't necessarily involve being all funny for the patient. It really helps the medical personnel too, and that's what we used to talk about. And humor is, to me, is sort of a fixed way of. If you can't see humor in most of the things you deal with during the day, you're sort of stiff, and you need to lighten up a little bit. Overall, though, I think I look back on my cases and all the cases that I've seen. I enjoyed the direct care, and not where I just stick somebody in the hospital and then let the other doctor take care of it. I want to see them myself. I was looking through my little books that I used to carry for my patient load. I would carry a small book given to the doctors about SIBA. SIBA is a drug company that made a lot of the drugs that they use, of course. But I had a whole bunch of these little books for the years that I had done the care. And with each one of those cases that I have, all I have to do is have a name on there like somebody like George W. And that would bring up instantly in my head, I'd know who that was. George was the one they had trouble with. He's the one that got up and walked out of the hospital one night. We had some funny cases at times. We saw almost everything that went on with people in their care. Know your medical portion of it. Learn how to take care of tuberculosis of the spine. Learn how to deliver a baby in case you have to. Because nowadays they're all done at the hospital, just about. But be sure that you have your division of medicine that you like well thought out, and also training-wise, embrace everything you can to know about it. Then, to make life happy, talk to people. And if you don't talk to them, you're not going to get to this humor portion of it. And if you learn how to do that, I think you'll have no problems. And that's a simple, short answer. But if you don't do that, you're going to have a lot of problems. You can't be somebody that just comes in and just stands at the foot of the bed and says, "Well, this is such and such. We're going to do this. You're going to have that. And goodbye." Well, I learned it from a combination of things. I grew up in a small town, and we had a family doctor, but there were three and a half, I say, three doctors that worked regular general practice, as they called it, and then there was another one that was not there very often, called, so he's the half. That's why I call it 3.5 doctors. And you know, I found out through the years, through going through college, going to medical school, going to the various other things that I've done, and like she said, the delivery portion of it, that's really one of the most thought-provoking things that any doctor could do. If they don't think that's a miracle, then they're having a very sterile life. Through my experience, I saw a lot of different cases of things. When I was in medical school, I did part-time work in moonlighting, and I had patients from Jewish Hospital in Louisville, St. Francis Catholic Hospital in Louisville. The Catholic portion of it was administered by a couple of Catholic doctors who had a small hospital for the psychiatric patients. And it was interesting to see all the different ones. So I saw people there in Louisville, and then I came to St. Elizabeth Hospital, and that was all Catholic. Saw them, but during my internship, I worked some at the hospital. I gave anesthesia to care for the excess cases where they have ran out of an anesthesiologist. So I would do the short ones that we'd have to do. So I saw an awful lot of different ways of practicing medicine, and I think that's probably helped me meld out and to have a grasp of all the various things that can be done. I had one doctor. I was helping him with a thyroidectomy, and we got to talking, and he said he felt dizzy on this thyroid thing before they started even. So I'm talking about the doctor, and the doctor did the thyroid nodule and was just about ready to close, and he said, "I don't think I'm going to make it." So I wound up closing him up and getting rid of the other stuff. He was a diabetic, and they had to give him some sugar. I'm over here taking care of the wound. Everybody else is over there taking care of the doctor. But I saw a lot of different things in different medical practices, and that helped me decide that I enjoy what I'm doing, so I don't really want to change too much.